MSK, the wrist. All right, so the wrist is actually relatively high yield, which is kind of annoying, but it should be relatively straightforward, easy questions that you can get off rip. All right, so what they want you to know first off is kind of the location in which you'll see each of the bones. So remember, the scaphoid is going to be near your thumb, but it's going to be more proximal, and the trapezium is near your thumb as well, but that's going to be more distal. All right. That's kind of like the two big ones. You also have the lunate. It's going to be medial and distal, or in proximal, I should say. And then the last one is going to be the hamate, which is going to be all the way on the outer side, and it's going to be near like the pinky, but it's going to be distal. Okay, so remember those three locations. They can like point at one of those bones and then ask you what's going or which bone it is. Okay, so I would remember the scaphoid, the lunate, and the hamate. Those are the highest yield ones. Okay, so first off, let's talk about the pathologies associated with each. I'm going to go in just like a quick 1, 2, 3 manner, and you guys should be able to get it like off rip. Okay, so I'm going to give you just the fastest summary, and you should get every single question based off of it. So first thing is fracture complications. We're just going to talk about fracture complications. So fracture complication of the scaphoid. Okay, scaphoid is the most common avascular necrosis, so the most common broken bone, and it can lead to avascular necrosis and radial artery damage. Next is lunate. Lunate is going to be medial nerve impingement, which can lead to carpal tunnel. Lastly is hamate, which is ulnar nerve compression, and it could lead to Guyon canal syndrome. All right, so let's walk through this one time. The scaphoid, it's the most commonly fractured carpal bone. Okay, now usually what happens is that you'll have a fall on outstretched hands, and it could cause a scaphoid fracture. Patients are going to have pain on palpation to the anatomic snuff box. Okay, and if you don't know what the anatomic snuff box is, what I would recommend you do is hyperextend your thumb, and you could visualize kind of a small little box in the area kind of close to your wrist. That's known as the anatomic snuff box. It's a dip in. The reason they call that is because back in the day, or still currently, people would put cocaine within the anatomical snuff box and sniff it out of there. That's why it's known as the anatomic snuff box. Okay, but past that history lesson, what you need to know is that palpation to that anatomic snuff box will elicit pain in patients that have a scaphoid type of fracture. All right. Now, complication of the scaphoid fracture is avascular necrosis. So it's scary. All right. You don't want to have avascular necrosis of that bone. So that's very important to note. Now, you will also have some type of radial artery involvement because you have non-union due to retrograde blood supply from a branch of the radial artery. So the radial artery is usually what's supplying the scaphoid. Okay, so that's what they want you to know, radial artery involvement for the scaphoid fracture. All right, so when I compress all that information down, the scaphoid is the most common fracture, and it could lead to avascular necrosis, and you'll see radial artery involvement. Patients will have pain on anatomical snuff box palpation. Next is the lunate. Okay, so let's look at where the lunate is. All right, the lunate usually can be dislocated. All right, and so when you have dislocation of the lunate, it can cause impingement of the median nerve. And when you have impingement of the median nerve, that can lead to carpal tunnel syndrome, which we'll discuss later on. That's what you need to know about lunate. Last one is hamate. Okay, fracture of the hook of hamate can cause ulnar nerve compression. And when you have ulnar nerve compression, you're going to have Guyon canal syndrome compared to when you have median nerve impingement, that's carpal tunnel syndrome. This one's going to be Guyon canal syndrome for ulnar nerve compression. All right, so that's the main takeaway. Now, the way that I remember it, scaphoid is very easy to remember, right? Most common avascular necrosis. You already know this, radial artery involvement, and you have anatomical snuff box. I feel like everyone knows the scaphoid injury. But the lunate and the hamate's one that's we really haven't been tested on previously. The way that I remember this is lunate is associated with the median artery, is by just like A, B, C, D, E, F, G, H, I, J, K, L, M. So lunate and median artery. L is right before M in the alphabet. All right, and then that's how you know that the hamate is the last artery, the last nerve, which is going to be the ulnar nerve. So hamate is with the ulnar nerve. All right, you know that hamate's not going to be with median because lunate's with median. All right, so that's kind of the main takeaway. Once again, scaphoid, most common, it's going to lead to avascular necrosis with radial artery involvement and anatomical snuff box palpation. Lunate is median nerve impingement, leads to carpal tunnel. Hamate is ulnar nerve compression, that's going to lead to Guyon canal syndrome. All right, that's your wrist region.